Hi, it's Dr. Lindsay. This is one of a series of talks that I'm putting up on the internet to discuss different topics that come up in our office. Today's topic is going to be on patience and time frames after your hair transplant. So you either had a hair transplant or you're getting ready to have a hair transplant. Congratulations to you. The hard part is not really handing over the money, getting the numbing shots, or sitting still all day. The hard part is waiting for it to grow in. Here's what I tell patients at our office as to what to expect over the next 12 months. The night before surgery, it's normal to be nervous. Some people are just terrified. I would probably be in that group. And time passes very slowly for them. Others, the time just scoots right by, and in no time at all, it's 7:30 and we're ready to start your case. After the first 7 numbing shots that are placed in the back of your head, which do hurt for probably 3 or 4 seconds apiece, the rest of the day is really pretty much a breeze for most of our patients. Once you've made it through the rest of the numbing and the removal of the strip, which really shouldn't hurt at all, people get very relaxed, and I'd guess half fall asleep at some point during the case. We usually finish about 1 or 1:30 in the afternoon, and the patients either go back to their hotel or go home. The first night there's going to be some pain. We do roughly 122 strip cases per year. 2 people a year, every year, don't take any pain pills. And 1 person per year, every year, asks for a refill of their 20 Vicodins. But on average, people take about 6 pain pills divided over the first 3 days. The first day out from surgery, you typically don't look too bad. We have a little compression dressing that you either take off or you come in and we take it off and show you how to clean. The second and third and fourth days after surgery, there's a lot of swelling, but the pain should be pretty much all gone by this time. It's just swelling, more than you're going to expect, more than I've prepared you for, and more than your spouse or significant other is prepared for. But that's normal. Typically, by about day 5, that's mostly gone, and day 7, we remove sutures. Most people don't clean enough because they're afraid they're going to pull out hair that hasn't taken root, and that they haven't finished paying for. That's okay. It typically doesn't affect how it grows, but it's ideal if you do follow the clean instructions that either we or your doctor gives you. Once the sutures are removed, there's oftentimes a little bit of a letdown, almost like the day after Christmas. This is really common, and I see it in facial plastic surgery procedures as well. We see you back in a month to check your scar, and typically at that point, most of the hair that has been put in has shed. And if you had pre-existing hair in your recipient area, that too is shed, and what's called shock loss, which will be covered in another video. Most people have report by about 30 days that most of the numbness in the back of their head is resolved. We ask people to come back at 6 months when the hair just begins to grow, and then we like to see folks at a year for pictures. Now it's a bell curve. Typically you can expect to have your final result at about a year, but there are fast growers and slow growers. But on average, 12 months is the amount of time it takes for a hair transplant to grow in. For revision cases, I would probably add 50% to each of these time periods. It takes about 18 months to get your final result. And pain may be a little bit more or a little bit less in revision cases. So in summary, patience is a virtue, and it's going to take a while to get the results of what you have either had or getting ready to have. But congratulations and good luck to you.